Welcome to ExpertCast, the podcast dedicated to innovation in healthcare. I'm Gustavo Meirelles, Chief Medical Officer at AFIA, founder of the Healthcare Innovation Community, and co-president of the AFIA Institute. It's a pleasure to have you with us for another conversation about the future of healthcare. In today's episode, we'll talk about one of the most impactful areas in women's health, breast cancer diagnosis. We'll discuss how early detection, advanced imaging, and artificial intelligence are transforming screening programs and improving patient outcomes around the world. To explore this fascinating topic, I'm honored to welcome Professor Hilde Bosmans, Professor of Medical Physics and Radiation Protection in Radiology at KU Leuven, the Catholic University of Leuven in Belgium. She leads a team of researchers dedicated to improving quality in radiology and breast cancer screening, working closely with imaging vendors and healthcare providers to ensure the best possible diagnostic performance, always at acceptable X-ray doses. Welcome, Professor Hilde. It's a pleasure to have you with us.
Good evening, ladies and gentlemen.
So thank you again for being here for ExpertCast. And to begin, could you share why participating in breast cancer screening programs is so crucial, not only for individual health, but also for population outcomes?
Yes, of course. Thank you for this question. As we all know, breast cancer is a common disease that starts very silently. We cannot feel it. It's not painful. We cannot touch it. And therefore it goes undiscovered. But X-rays can play there a major role as they are able to detect the small cancers. And via screening programs, that's exactly what we are offered. The possibility to get this X-ray exam such that the cancer can be found when it is still very, very small. So it's important for the individual women, you and I, and that our cancer gets detected early on. But it's also important that many women attend the screening program. And there may be financial reasons, but I think the human reason is more important. If a lot of women would go, you would start hearing this, like that woman got the cancer detected in the early stage and she will survive the disease. And when more and more positive voices come there on the cancer detected when it's early, when the treatment is not painful, that will pay off because it will give a type of a boost to screening programs, to breast cancer care, to cure. And maybe also governments will then start investing into the care for the women with the small cancers. So I really hope that this type of message of hope would go into society and that we can then all together get the mortality down of breast cancer.
Certainly. I hope the same too. And breast cancer screening, as any other type of screening for early detection of cancers, is something that dramatically increases survival rates. And in your opinion, how have modern imaging technologies improved our ability to detect breast cancer at earlier stages?
Thank you very much. As you may know, I have a career in checking the quality of these X-ray devices. And the quality, of course, has improved over time. And the quality is now also much more stable than it was early on. It is the quality will be good for the people with the thin and dense breast, but also for the women with some larger breasts. The main point is, of course, that we can now see smaller cancers with more detail, such that radiologists can better find out what they see and detect the cancers. But it's not only the technology that has improved over time. There are all the other aspects. There have been schools telling how to position the breast, and so radiographers are better trained now. We use the better devices, of course. Also, radiologists have followed a lot of courses Also in screening, it's in some countries now the case, and like in most European screening situations, that images are read by two experts. We call this a double reading, so that radiologists now accept that their case is reread by another one to have this double reading and improve the diagnosis. Then, of course, there are also better monitors to view the images and better processing to make the images sharper and showing more of the details. Then we can even add artificial intelligence that can help in reading. So overall, the evolution, in fact, has been enormous on all aspects because we have carefully split the whole process in little parts that have been improved separately and then all together.
This is excellent to know again, and we are going to cover a little more on AI in the next part of this episode. But now I would like to cover something that you have an enormous experience, which is image quality in mammography. So, in your view, what are the main factors that influence image quality in mammography, and how can one balance optimal image quality with radiation safety?
Okay, yeah, thank you. Thank you very much for that question indeed. Well, good image quality starts technically with a good imaging device that should be stable, that should produce sharp images. It should not use too much dose. It should be operated correctly with the right dose for the right person. And that will already create a good X-ray image. But as I said before, all the other aspects, like the perfect positioning of the patient, and then the good visualization of the image, the processing on the image, the reading of this image, all this makes up that today the quality is really much better. And especially following the European guidelines, all this is put in a quality assurance setting that makes the testing and the testing and obtaining quality a requirement, in fact. And it's nice if in your country the screening program is at that level and ensures that all possibilities, all opportunities are taken to make it a good quality experience.
Thanks again, Professor. And our last question for today's episode, again related to breast imaging technologies. So they have evolved significantly over the years, but could you highlight some of the most important innovations that have transformed that field recently? I mean, in the last few years, which are the main technologies you would like to highlight for breast imaging assessment?
Okay, a little longer ago than the last few years, we have seen the transition from film screen to digital imaging, and that was surely a big step in the good direction. And with digital imaging came all the possibilities of image processing, and now recently of artificial intelligence techniques that can go with you over the image and try to detect even more lesions than the human eye would see. So that is a tremendous step being taken at this moment. Thanks to this, the fact that images are digital, it's also possible to combine them with other images. And we have seen three-dimensional techniques coming up, like breast tomosynthesis, where different images are taken over an angle using a normal imaging device and being combined in a 3D representation of the breast, which of course adds this extra dimension. Another recent development is the injection of contrast agents in the so-called spectral mammography. And the little disadvantage is that the woman has to get this contrast agent injection. But the advantage is that we can see then in the image which part of the breast is taking up this contrast agent. And that could, for instance, be the tumor that we wanted to detect. And that brings a mammography device now more or less at the level of an MRI device, where also the uptake of a contrast agent is shown. And next to X-ray images, we have improved MRI techniques. We have also now automated breast ultrasound that scans the breast by means of ultrasounds in a 3D view. So altogether, that is at this moment, a big package of tools. Maybe the difficulty now becomes in what to do first and how to combine these imaging tools to come to the proper diagnosis. But it's certainly exciting.
That's great. And could you highlight a little bit more on, automated ultrasound and also new techniques for MR? I know that many of our listeners, they really like to know what is like top of mind in new technologies. So if you like to speak a little bit more to those two techniques, MR and automated ultrasound, that would be great.
Yeah, well, it's not my domain of expertise, but I've seen it being introduced indeed in the hospital. In normal ultrasound, the difficulty is that it's very difficult to make these images in a reproducible way by different operators and obtain the same view of the cancer. And also ensure the whole breast is carefully examined. With automated breast ultrasound, this limitation is gone, as the breast is also scanned by means of ultrasound completely. But it is a new technique, and the radiographers have to learn it. Now, in our country, ultrasound is normally done by the radiologist. The automated breast ultrasound can be done by radiographers, well-trained radiographers. But this training has to be done and is still developing, I think. So at this moment, our experience is a bit limited, but it is surely a promising technique. And regarding MRI, there is, of course, also the revolution that comes along with artificial intelligence techniques being introduced to make the reconstruction better, faster, less time consuming. And at this moment, the so-called abbreviated MRI techniques are being explored, where the whole examination can be much faster, and therefore maybe the throughput and patients can be higher, maybe the costs being reduced. So there is certainly also there's something we should also look into, I think. Probably ultimately we would like to solve the whole question just in one room, like a mammography room with a 2D mammogram, followed by maybe a tomosynthesis. If there is a suspicious lesion, immediately a contrast mammography. And if that is confirmed, the biopsy just in one quick run. For me personally, this is now really personal, I think that what we should aim for ultimately is to really shorten the time between the first detection of the cancer and the biopsy. Because all the time the women have to spend at home waiting to come back to get the next examination. This is time where the woman starts panicking and panicking, I think, is the right word. Seeing all types of episodes, imaginary episodes on what will come. I think we have to try to calm down the woman as much as possible by make this shorter, like a one-shot experience from suspicious lesion up to the biopsy. And these new techniques can surely be of help.
Well, thank you so much for those wonderful insights, Professor Hilde. And we'll definitely explore a little more on new technologies and including AI techniques in the second part of our episode. So, in the next episode, we'll go deeper into how artificial intelligence and also collaboration across different imaging ecosystems are reshaping the future of breast cancer diagnosis and treatment in order to detect cancer earlier and more accurately. So, thank you again for being here. I will definitely have you again in a week here for the next episode of ExpertCast.
Thank you.
So if you'd like to continue the conversation about healthcare innovation, please join the healthcare innovation community, which already brings together over 13,000 professionals interested in the field. So visit inovaçãosaude.com and register for free. ExpertCast is a project supported by Agfa Radiology Solutions and produced by SoPods. If you enjoyed this episode, don't forget to follow our podcast, give us a 5-star rating, and share it with your network. Thank you again, and see you in the next episode.